Hello, everyone. I'm Catherine Stickney, the founder and CEO of Parity.org, as well as a board director for Hint Health. I'm delighted to be here at the Hint Summit 2D to introduce Zak Holdsworth. But first, my story is a bit intertwined with that of Hint's. I've been a healthcare executive for 30 years at companies like Cigna, Kaiser, and Sutter Health. I met Zak when I left the corporate world and transitioned to advising healthcare tech founders and venture capitalists on market strategy. Hint was just 2 years old, when I met Zak, and I loved what he and the team were doing. I knew that DPC was the way of the future of healthcare delivery, and that creating a network of providers that represented a DPC way of care delivery would be a winning formula for success. Early on, Zak asked me to formally join Hint as a strategic advisor, and I enthusiastically accepted. But my journey took a turn 3 years ago when I started Parity.org. We're a not-for-profit organization that's closing the gender and racial gap at the top of companies, where the gap is the widest. Today, nearly 500 companies have taken our Parity Pledge to simply interview at least one qualified woman and person of color for every role, every open role, VP and higher. And that's really where the gap is the widest, is at the top of companies. Nearly 500 companies have taken our Parity Pledge to simply interview at least one woman and person of color, as I said. Companies like Athena Health and large health systems like Atrium, Satellite Health, Henry Ford Hospitals, as well as health plans like Blue Cross have also taken our pledge. Before I joined the Hint board as a director, Zak took the Parity Pledge to signal to his employees, his customers, and his partners that Hint had embraced diversity and inclusion as something that is essential for the success of his company. He knew then what many know now, that making a public commitment and following through has been shown over and over that employees are more engaged, your customers are more loyal, and financial results are more predictable and positive when diversity and inclusion are part of the company's value system. Today, company brands are inextricably linked to their values. To your customers, not to mention your employees, your values are your brand. Zak has a clear sense of the value that diversity and inclusion brings to the Hint culture. The team and the board know that Zak values ideas and innovation from everyone on the team, regardless of race or gender. He formed a diversity and inclusion committee and has made sure his policies, benefits, and programs are accessible for everyone to thrive at Hint. So much so that Hint Health was one of the 35 companies honored by Parity.org's Best Companies for Women to Advance this year, along with other great brands like Banner Health, Blue Shield of California, Evolent, and from outside the tech industry, companies like NASDAQ, Pepsi, Clorox, Best Buy, and Ralph Lauren also made the list alongside Hint Health. I would encourage any of you in this session to go to Parity.org, click the green button, and like Zak, join us to change your culture for the better. Your employees will applaud you, your customers will reward you with their loyalty, and I will thank you. Now, it's my distinct pleasure to turn the microphone over to my friend, Zak Holdsworth, founder and CEO of Hint Health. Zak?
Thank you so much. Thanks so much, Catherine, and also just thanks for your very kind words. I really appreciate it, and also just for your counsel. And I do recommend folks go and check out Parity.org. It's been a really inspirational kind of experience for us to partner with them and try to better ourselves. So thanks so much, Catherine. I really appreciate it. So today, team, it's been just an action-packed day, and yesterday as well. And I've actually got a pretty action-packed about an hour I'm going to be with you, but I'm breaking it up into 3 sections. The first is we're going to be spending a bit of time just talking through kind of our vision for how we believe we can help play a part in transforming US healthcare. And this is a question we get a lot from our clients, what our longer term vision is. And so I wanted to spend a bit of time talking about that. In addition to that, I'm actually going to be taking you on a bit of a customer journey. So last year we looked at some 3D data visualizations. Given it's Hint Summit 2D, I'm actually going to be doing some 2D data visualizations to help kind of show the journey that we've been on at Hint, along with our community. And then finally, and actually during that time, I'm going to be having a fireside chat with some new partners that we're really excited about who are sort of on this journey with us. And so you'll hear from them later on. And then finally, we're going to wrap up with a talk from our VP of Product, Jennifer Rabiner, who is going to be taking you through some of our product vision and our product strategy as it relates to the sort of company vision and the evolution that we believe is starting to happen in US healthcare. So that's what I've got for you then. We're going to be doing a little bit of a recap at the end. But before I jumped on and we talk about vision, I wanted just to spend a little bit of time acknowledging our sponsors. Without our sponsors, we wouldn't be able to bring this event to you. So you can see the names up here, but thanks so much, Sedera. We've recently announced a new partnership with Sedera, sort of an upgraded version. Thanks to Elation, who's been one of our longtime partners and friends, and we share a lot of customers with. And so we've actually, I think, some exciting stuff coming on down the pipe with Elation as well. Thanks to Athena, who's one of our newer partners who we're excited to partner with to serve our mutual communities. Nextera Healthcare, so Clint and the team at Nextera have been actually an integral part of our journey and always supportive of Hint Summit. And then of course, Health Rosetta, who I'm sure a lot of you have seen over the last few days, who's been not only supportive with this community, but is also just a great partner so that we can kind of push in the same direction. In addition to our sponsors, we had a bunch of exhibitors. I hope you've had the opportunity to go and see all these exhibitors. In addition to the sponsors, we've also got Spruce, Equal, who you're going to be learning a little bit more about later, Acute Health, and both Roamed and Align Health. And then last but not least, this year we wanted to try to expand to bring more of the residents and med students into this community. So along with Nextera Healthcare, the following very generous folks actually helped fund the free tickets that we were giving away to residents. So thank you so much, Dr. Clint, Dr. Kyle, Dr. Phillips, Dr. John, Dr. Amber, Dr. Lisa, Dr. Jerome, and Dr. Dan. We really appreciate it, and as I'm sure the residents do at who are here with us. And I think there's been about 130 residents sign up, so it's been a great outcome. Jumping into our vision, this is actually a quote that Dave Chase mentioned in one of his talks, and this has been a quote that I think is sort of, to a certain extent, a little bit of a guiding light for us, but you really never can change things by fighting against the existing reality. In order to change something, you need to build a new model that makes the old model obsolete. And with our journey here at Hint, as we've been sort of going along and trying to figure out what are some of our North Stars, from the very early days, we were trying to figure out, okay, what are some of the fundamental problems with the US healthcare system? And over the time, I've sort of refined my thinking and sort of our thinking here at Hint, is it really comes down to three things. The first is lack of price transparency. And we've heard this, over and over here at the Hint Summit, but what other industry is there where the person buying something doesn't know what the cost is, the person selling it doesn't know how much they're going to get paid, and basically just absolutely no sort of price transparency across the ecosystem. So this is kind of one of the sort of clear and fundamental problems with the US healthcare system. The other issue here, and these are all interlinked, right, these issues, but the second is this: there's perverse incentives everywhere within the healthcare system. And I actually think this is something that doesn't just happen with any single stakeholder. You have perverse incentives on the provider side, right, in a traditional fee-for-service model, right? Your incentive is to drive volume, right? It's not to deliver the type of care you see within a direct primary care model. You also have perverse incentives with on the payer side, right? The large payers, their incentive in the short term is to deny claims, but their incentive in the long term is to drive costs of healthcare up. So you've got these super weird, perverted incentives that are even countering each other within that ecosystem. And then you've got, obviously, across the board, perverse incentives that are just sort of injected in within this ecosystem. And then the third here is just the absolutely massive administrative overhead. 10 administrators per doctor in the US healthcare system, hundreds of billions of dollars wasted on sort of unnecessary processes that just don't really make any sense. So as we've been kind of moving on our journey, the way we tend to think about it, okay, in order to transform US healthcare, we really need to change these things. We need to bring price transparency back, right? It's pretty obvious, but without price transparency, there's no way that we're going to transform US healthcare. We have to make sure incentives are aligned and make sure the underlying business models that are being deployed actually have natural incentive alignment, so that you're not fighting, for example, telemedicine, right? It should just be an obvious, natural kind of evolution of care delivery to include something like telemedicine. And so in a fee-for-service model, they have to have a code for it. In a direct primary care model, not so much. And then, of course, low administrative overhead. There's no reason that 30, 40, 50 cents on the dollar should be going to administering payments, administering care. That doesn't make any sense. And of course, if you think about it, the culmination of all of these things is what drew us to direct primary care. We truly believe that the direct primary care model can really become the foundation of tomorrow's healthcare system. These types of models are what are the seed with which the sort of innovation we need to happen within healthcare can grow around. And one of the things that's interesting about the kind of these models is that, for a start, when you do have this nice kind of direct kind of natural incentive alignment, what you start to see is the business model that the direct primary care providers are delivering. Because of the way it's set up, it just flows, right? There's you have if you look at the traditional fee-for-service models, we were seeing anywhere from 30 to 70% drop in revenue during COVID. Well, if we take a look at the data that we have, we're actually seeing membership growth experience through this COVID time. And so this is one example of how the fee-for-service model is fragile, right? The direct primary care model, to sort of quote Nassim Taleb, it's anti-fragile, right? You pressure it, and it actually responds in a way that makes it stronger. And so that's something that I think is super critical to kind of reforming US healthcare system. The other thing that's been really interesting is because if you have that natural incentive alignment, what we started to see on the hint side is if we actually look at COVID kind of cases on a daily basis, we actually have a bunch of data in our system on daily virtual visits or charges across the system. And what we observed was that our clients actually just naturally flowed with what was happening. They sort of reacted in real time to what they were seeing in the market, such that they could create the type of value needed at this moment in time. And I think this is a really powerful, just a kudos to this community to reacting to this, to the COVID pandemic in a way that almost no other part of the healthcare system was able to do. So this is just, kudos to all of the kind of thought leading, pioneering doctors in this room that figured this stuff out. The other thing that's, worth noting here is that, and I guess this brings me to sort of the kind of vision part of our talk, which is our business has been built on the foundation of this idea that we believe direct primary care needs to become kind of like, as I said earlier, the sand with which the pearl grows around. But direct primary care by itself isn't going to solve the US healthcare crisis. It needs to be integrated in ways that what we're sort of starting to refer to as direct care. And what I want to do is just spend a few minutes talking through kind of our vision for how we believe that direct primary care can sort of evolve beyond primary care in ways that we're seeing, happening within the community. And so I want to kind of share our long-term vision statement. This is something that I haven't really, I don't believe shared before with this community. But our vision at Hint is to redesign the healthcare system to enable affordable and easy access to high-quality care. And you can sort of see some of the kind of words of it in here. But at the end of the day, we believe that it's crucial that we transition away from these insurance-based models where 80, 90, 95% of care is delivered through a claim into what we refer to direct care. And I just want to take you through kind of the three different phases of how we see this evolving. So the first phase is obviously just enabling this growth and success of direct primary care. And this is really what we've been focused on for the last 7 years or so, since late 2013, where we went to the first direct primary care conference. And it's really at that conference, in addition to conversations with a number of other kind of doctors that we kind of came across in our in our journey, that we realized we have to work in this community, right? We have to start this business, because it was the first time that we had the light bulb moment where we were like, if every American had something like this, if every American had this type of relationship with their doctor, then it would fundamentally transform US healthcare. It would, and in doing so, eliminate hundreds of billions of dollars of waste, while improving quality, access, and the kind of restoring the patient-physician relationship and restoring the love of medicine. So that was kind of that was really the first kind of foray for us into direct primary care, and that's what we've been focusing on. What we've started to see happen is increasingly, and I'll talk more about this later on, but increasingly we're seeing direct primary care groups, both small and large, starting to work with employers and just generally plan sponsors that have recognized the value of direct primary care. And we're actually going to be sharing some statistics later on the number of attendees who are actually actively working with employers. But the next phase of our evolution in terms of our strategy was the need to actually start embracing these employers and plan sponsors who want to authentically integrate direct primary care into the heart of what they're doing. And so this has been a kind of a big part of our strategic plan, as well as our product strategy, to continue to enhance our platform such that we can kind of flow with this evolution. And so if you kind of think about these first two phases, what the end goal here is to create this sort of new ecosystem whereby this interconnected ecosystem that collectively outperforms healthcare's insurance-led status quo, right? We're not going to win this battle if it doesn't outperform the status quo, and it can't be a little bit better. It has to be a lot better. And so what we see here is, what we're starting to see is obviously direct primary care providers are starting to show that with data, with studies, that they have the ability to improve access, quality, and outcomes for plan sponsors. But in addition to that, and by plan sponsors, I'm going to kind of talk a bit more about that later on. But in addition to that, what we're seeing is these plan sponsors are growing the patient panels for these direct primary care providers. And so that's obviously good, right? Growth is good if it's the right type of growth. And I really enjoyed actually, it was Sharud from Acute in his session where he talked about make sure you don't compromise your values when you engage with a new constituent or you engage with a new patient that maybe doesn't appreciate the value you're bringing. Don't lower your values to do that. And I think in this phase, one of the things we've been really thoughtful about is who are the right partners and the right groups to bring into this community such that we don't threaten the integrity of the direct primary care movement. So that's kind of phase one and phase two. I want to just spend time now talking about this third phase, which is integrating downstream care with primary care. And this is something that we've seen happening a lot within the community, just naturally and organically. But it's a direction that we're starting to get pulled from in terms of kind of our strategy and both from a business strategy and a product strategy. So we're going to spend more time talking about that. But at a high level, right, when you start to integrate downstream care, and what we're seeing is local direct primary care groups are going out and actually negotiating with local imaging labs, specialists, surgery centers, the list goes on. And in doing so, they're actually driving referrals to those downstream care providers who are, given that they're being put into a price transparent, pre-negotiated arrangement where they don't have to wait 120 days to get paid 70% of the time. They're sort of leaning into these relationships, and we've heard from some of them here at Summit. But what this really does is, as I mentioned earlier, we're not going to fix healthcare just by fixing primary care. And so as we start to see more and more downstream care integrated into these direct primary care models, that has the effect of amplifying the impact of the direct primary care provider and growing the ROI of the plan sponsors or the individual patient if it's an individual. And this is we think of this as a very powerful force feedback loop that, if can be sort of nourished and scaled, is going to be the force that is needed to transform US healthcare. So that's the kind of high level. And I wanted to spend a little bit of time just talking through the customer evolution. And this is something we did last year during the HINT Summit, but we did it within the context of, as I mentioned, a 3D data visualization. And this was very powerful, but it was a little bit complicated. And to be honest, actually this year when I tried to do something like it, it actually overloaded, it was a little bit bandwidth hungry. So I've actually created a 2D summit. I've actually created a 2D version of this, worked with one of our engineers, and you're going to see kind of the evolution of our customer community. So this here, if you're wondering, this is Dr. Rob. Now, Dr. Rob was one of our first customers, but he was the first person to have a HINT account. I think it actually took him a month or so to actually, for me to convince him to actually use it. But he has the first HINT account, and you can see this node here. There's one account and one location. And what I wanted to just do is take you on a little bit of a journey. So check this out. As we scroll through time, what you're going to start to notice is a growth in, providers here. And so the blue dots, this is think of this as a HINT customer, and think of this as what this is actually NextEra Healthcare before they were actually a DPC network. So Clint, sorry, I'm sort of, hope you don't mind. You're gonna be part of my story arc here. But I just wanted to point that out is that, this is a kind of a DPC network, a budding DPC network, and these are providers that are kind of in our community in those early days. If we continue to scroll through time, what you're going to start to notice here is there's blue dots that are coming up. And what these are locations. These are locations, so this might be a multi-physician group with multiple locations. And the red dots here, what that's showing is employers. So we started to see employers entering the space. Now, most of these were probably small employers, but nevertheless, back in early 2015, we started to see traction with employers. And of course, this kind of drove us to further innovate as it related to our employer platform. As we continue to scroll through time, what you're going to notice is, you start to see more and more clusters forming with more and more groups that have, more and more employers, and of course, more multi-location groups. And you'll also see some other networks forming, which we're going to talk a little bit about later on. If it's easier to see, I might just see what black looks like. That might be easier for us to kind of look at. But as you can see on the right, there's a number of accounts, number of locations. And remember, we're still back in early 2017 here. So as we continue to go through time, what you're going to start to see is obviously this growth in employer. And this growth that you see really pushed the limits for HINT. When we started, we were a simple kind of membership management system. And as we had more and more of these providers working with more and more larger employers, it pushed the limits of what our system could handle because it's a little bit different. And so we actually started building some infrastructure to support kind of this rapid growth of employer demand. And so I wanted to just share with you some data over the last 6 months. We've actually had to build a feature to help support this growth. This is actually that data. This is a product we built, which we called Eligibility Autosync, which really essentially what this does is it ingests a feed from an employer or their TPA of all the lives that and members and employees and dependents basically that are eligible for care. And our system kind of automatically ingests that data such that it's always up to date, near real time, either daily or weekly. And what you'll see is there's now more than 100 employer TPA feeds active. There's about 130,000 lives that are actively being managed through this infrastructure, right? And over the last 6 months, there's been more than 3 million rows processed by that infrastructure, which is because we're updating, in some cases, updating members or patients daily or weekly versus say monthly or quarterly. And so over the cumulative data here shows about 8 million rows processed, and this is something that historically probably would have been done manually using Excel or something. So we're sort of excited about this growth, but I think it's just very powerful to see how this community is continuing to scale. So if we get back to this network map here, which shows kind of this evolution, and by the way, if you want to know where you are, you can maybe Slack in the channel, but Nextera Healthcare, you can see, is right in here. So that's Nextera's account back in 2017. So sorry, Clint, I keep sharing all your data. I think you gave me approval, so. Anyway, so we keep going through time. And what's interesting with this evolution, as we continue to scale through time, is you start to see more and more clusters. And what you'll notice is in April 2019, we start to see some network connections forming in our ecosystem. So again, this is Nextera Healthcare. And we're actually pushed down a path of actually building infrastructure to support these really innovative provider-led models that we're starting to create connectivity within our ecosystem. So, what you'll notice is as we kind of scroll through time, you'll start to see this really interesting evolution of this ecosystem. And what's important to note here is that Hint isn't really doing anything other than enabling the connectivity and innovation that's happening within our community. A lot of the time people ask me, does Hint have a network? I'm like, no, we don't. We just have a bunch of docs that are renegades that are sort of innovating in ways that we would have never imagined. And so you can start to see this evolution happening through time. But if we zoom in on this, again, this is Nextera Healthcare. This is these have got a bunch of affiliates. They've got a bunch of individual locations that they own and operate. They've got a bunch of their own employers, and they've also got a ton of affiliates that also have their own employers, that also have their own locations. And so this is just really interesting. We even have networks that work with other networks, and multiple different networks forming, which is just really interesting to see. So that's kind of we're almost at the end of time here in terms of kind of this data visualization. But one of the things I wanted to highlight is early on in this evolution, we actually started to see plan sponsors start to come to us. And what you'll notice if we go in and type in Decent was one of our early kind of plan sponsored partners. And you can see them in here. I've just highlighted them. They were really, they came to us very early on in the evolution of a business and were fascinated by this evolution in primary care and wanted to build a product that natively integrated these types of care delivery models whereby the physician was able to continue to maintain their own pricing, continue to deliver the care that they wanted to deliver, but was doing so in such a way that allowed the members of Decent to get access to this community. And so this was, something that we thought, this is cool. Why don't we support this as well? And so the same infrastructure that is kind of powering these DPC networks, which is really nothing more than creating connectivity between Hint accounts, was deployed to support this. So you can kind of start to see this evolution happening here in real time. And so the thing that I wanted to kind of announce today is that we actually have a number of new, what we call sort of plan sponsor or TPA partners that are actually integrating with our APIs such that they can natively integrate kind of and partner with our community of providers in a way that's very seamless, where there's price transparency, there's very little to no administrative overhead, and there's no perverse incentives in that relationship. And so we've actually decided to kind of formally bring a product to market that is designed to support these types of plan sponsors. And so I wanted to kind of bring on the stage here with me a few folks here. We've got, pull the slide up, we've got the CEO of Equal, Ameeth, who you heard from, the CEO of the Kempton Group, Jay, we've got Jay Kempton, and we've got the CEO from Align Health, Troy Neiman. These are all new partners that we're very excited to kind of announce partnerships with. And we've been working very closely. It looks like we've got all you folks here. Good to have you on the line. So folks, what did you think of that, that data visualization? What are your thoughts?
I think we're onto something.
Well, actually, before we jump in, folks, I wanted to just have each of you do a very quick intro. Ameeth, why don't you kick things off, a little bit about Equal and what you're doing?
Yeah, thank you. So my name's Ameeth Reddy. For those of you that I haven't met, I'm founder and CEO at Equal Health, and we're focused on unlocking the DPC community for employers. And as Zach has mentioned, many of you are already contracting locally with businesses in your area, but there's this whole space of employers that have the resources to pay for DPC memberships for their employees all over the country that are kind of untapped. And so we've realized that there are employers in multiple geographies and multiple states that want to offer DPC, but because they're so spread out, it makes it challenging. So we built the software solution that makes it a lot easier for an employer or a benefits advisor to sponsor and manage a DPC program for their employees and connect them with independent DPC practices around the country.
Thanks so much, Ameeth. And Jay, what is the Kempton Group and how, like, why don't you just give a quick overview of how and why you're working with DPCs?
Yeah, Zach, we're a independent third-party administrator. We work directly with our employers. We've really gotten into the direct primary care space really to support our efforts in the direct contracting world. We've been doing business directly with different surgery centers, different free market, bundled cash medical providers now for about 10 years. And we see really along the lines of what Ameeth said, to figure out a way where we can start to integrate the direct primary care as actually part of the employer's benefit plan in the form of a subsidy to allow patients to go out and purchase their own direct primary care membership, but utilizing employer dollars to do it. And we think that retains the independence of the direct primary care physician and allows competition to continue to flourish. Thanks,
Jay. And I've been a fan of the work you've been doing with the Free Market Medical Association for some time. So thank you for that. And Troy, with our recent strategic partnership, can you just tell us a little bit about how Align Health empowers DPCs to go to sort of a new level of success?
Yeah, thanks, Zach, and hello everybody out there in the DPC world. So I'm Troy Neiman, co-founder of Align Health Partners, and we're really a DPC-centered, total health risk management model. And what we're really trying to do, or what we've done, is we've integrated using a marketing arm, a technology arm, a data arm, and an engagement arm to bring it all together for total solutions that are turnkey. So we're really trying to connect employers and individuals back with primary care one community at a time, but bringing it through data-driven interventions with major medical cost coverage. And it's all in one beautiful turnkey single sign-on system. So it's very supportive, it's very integrated, and it's really a holistic health risk management model versus kind of a reactionary healthcare model.
Awesome. So this is maybe an open question for discussion. A lot of the providers and doctors and folks, DPC providers here have just spent the last decade trying to get away from, TPAs and insurance companies and employers and so that they can kind of practice medicine. Why is this different? Why, what's different about this, or is it different?
I think it has an opportunity to be different. But I think that we all need to be vigilant, and we also need to be cognizant of the challenges and the problems that have gotten primary care to where it is now. I was trying to remind, consultants and employers that we work with, where they want to create a network of direct primary care, and they kind of want to bottle it up and turn it into a package. And I was like, that's a pretty slippery slope. I said, you've got to respect the doctor-patient relationship. You've got to be able to empower those patients to make the choice to do business or not do business with whatever primary care physician, direct primary care physician or clinic that they choose. Because I think that as we go bigger, you go up market with this, you start working with employers, start working with TPAs, there is a gravity well that is going to pull people back to what they know. And I think, again, us renegades, we need to be kind of standard bearers out there and say, no, that's what killed the golden goose. That's what got us into this mess. Let's be very cautious to not replicate that.
Right. Troy or Ameeth, thoughts?
Sure.
Yeah, I was just thinking. Oh, go ahead, Ameeth.
I've got a moderator. Ameeth, thoughts?
Okay, thank you. So just to echo what Jay is saying, completely agree. I think this can be different, and we have to be very cognizant of finding the right partners. Zach has mentioned that earlier in his talk, and what that means is finding partners who hold the same values around DPC and price transparency. And I think there are those folks out there, although you have to kind of look a little bit more closely. And earlier today, Dr. Paul Thomas gave a great talk on all of the people that DPC doctors have to compete with. The Minute Clinics, One Medical just went public last year. Amazon just signed a huge deal with Crossover Health. And so employers are investing in the primary care space with or without DPC doctors. So it's our goal and our hope that we can bring DPC doctors to the forefront and make them available and accessible, because we all know how much value that you all can drive.
Troy, thoughts?
Yeah, well spoken, Ameeth. I go back to something you said, Zach, and something that I took in the notes in the earlier sessions was, traditional insurance typically is the disruptor. When you really think about the model for, it's fee for service, and you look at our model and we're really the restorer, and we're bringing back, true health management. And so we need to become more health promotional. And when we were building Align, I thought it was interesting how you started, Zach, with your ecosystems. Our whole premise has been around realigning the incentives one community at a time, connecting people back to primary care. And when we went out and paneled a lot of primary care physicians that were working both in fee for service, but maybe hybriding over to the DPC model, one of the things they asked was, we need to get better at understanding our patients or our members. And it needs to be very member-centric around understanding their family history, their vaccinations, their lifestyle behavior. And then instead of reacting to disease, getting out in front of disease and proactively mitigating and managing to help people live their best life. And so I think right now, our culture is at a precipice to where, as we come together and bond in this purpose-driven mission to rebuild healthcare, now you really see the genesis behind our model, which was Align Health, where we're partnering to create that total deliverable.
Are any of you seeing kind of existing demand from in plan year 2021, or what's it looking like? What's the outlook look like in terms of demand for a DPC, do you think? And maybe, why don't we kick off with you?
Yeah, sure. No, I definitely think there's an appetite for it. There's an appetite for primary care and prevention, and COVID's only brought that top of mind for a lot of folks. Just since yesterday, I've had multiple doctors reach out to me by email and said, hey, we're talking to employers and they're interested, but we haven't been able to get it past the finish line, and because of their spread or whatever their other reasons are. And so there are larger employers, there are smaller employers, but everyone wants primary care, and DPC is really intriguing. We just have to make it more available.
Yeah, and Jay, maybe one for you here. Are there any must-have aspects of the DPC relationship for you or plan sponsors that practice should be aware of?
For us, the only thing, that we think about is, when it is time to upstream care, or I guess in your slide, downstream care, to a surgical center or advanced imaging or a hospital, we would just ask, for cooperation and collaboration, with the plan sponsor and with the self-funded plan. But it's got to be in a collaborative mode. And then the other thing I would comment about, what kind of demand we would see in 2021, out here in flyover country, in Oklahoma and Texas, we're finding that the larger employers, we're still having to explain direct primary care to them and kind of create the demand. But I mean, that's something that we're built for, and I think we're all up to the task. Having direct primary care physicians out there also knocking on doors really helps, and we appreciate the partnership with the DPCs in our area that are willing to go out and talk to employers with us.
Yeah, and on that point, Jay, one of the things we've seen is that generally speaking, if there is an employer or plan sponsor that is actually, has a really awesome offering for a DPC patient, then what we're actually finding is the DPC provider actually wants to lean into that because their intention is to provide the best access and best quality care possible. And so I think that's not really even a requirement. It's almost more, that's part of where I think these partnerships can actually really shine. So another question that came through from the crowd here was, how does the DPC set pricing? Do you set pricing? How does that whole thing work? And maybe we'll just, each of you will just quickly answer that question. We'll just see what the pattern is. Maybe we start with you, Troy.
Yeah, so in our program, we've created multiple choices, and as we've worked with employers that are fiduciaries out there, we've asked them, how well is your current plan performing? What can you afford as budget? Obviously, we care about quality access to providers, but then the big question pops up, which is what about major medical, and what about on-job injury like workers' comp? So we kind of gone down the road of the total worker health model, where we've built options where they can kind of choose from basic DPC, which is priced as a bundle, or they could go DPC plus health management, or DPC plus cost sharing, or DPC plus everything with major medical or self-funding and workers' comp integration. So we're trying to create a full option that's packaged in transparency, that's very simple, and that's like list billing to the employer with the buy-up options for the employees.
Ameeth, how does pricing work with you guys?
Yeah, thanks for the question. For Equal, when we work with doctors, we are very focused on making sure that they have price autonomy and autonomy for their practice. They can stay independent. And so we want doctors to set their own rates. We believe that's a strength of the DPC movement, and it feeds into the free market medical movement that we're all supporting. So we let the doctors set their own prices and the practices, and then we let employers offer a contribution so that their employees can shop around on our directory and have patient choice, pick whichever doctor makes sense for them, and essentially subsidize the membership.
And Jay, how does it work for you guys?
Sure, yeah. To echo what Ameeth said, it's none of my business what a direct primary care charges. All we ask is that you tell us what you do and tell us how much it's going to cost. And then again, like Ameeth said, we do structure the DPC integration into our benefit plans as really as a subsidy. Whatever the employer can afford, is it $50, is it $80, whatever. And then, these are the direct primary care physicians that are out there. This is what they charge. This is what they do. And if somebody wants to, write an additional check for the amount above their employer subsidy, so be it. And I think that's key for these direct primary care physicians to remain independent and retain their autonomy.
So thank you, gentlemen. It's been an absolute pleasure to have you here. We're really excited to partner with each of you. And for those of you who want to learn more, I think both Equal and Align have a booth. Please go visit them if I think the booths will still be open. Or reach out to these folks. And thank you so much for being part of this community. Next up, we have our VP of Product, Jennifer Rabiner, who's going to be joining us right now to talk through the next chapter. Right? So we've talked about the kind of evolution of our company strategy. Jen joined us to talk us through what our product strategy is and how it kind of hooks into that business strategy, and specifically as it relates to how we think about the next chapter in terms of connecting the downstream ecosystem.
Great, thanks so much. Well, I'm so excited to be here with you to help Zach close out this amazing 2 days of discussion and debate and learning. So I am going to give you a bit of a window into this next chapter for hint, as Zach mentioned, about connecting what you all do in DPC to this, what we refer to as the downstream ecosystem, the things that are happening outside of primary care. So you saw this image in Zach's presentation a few moments ago, kind of a simple depiction of the different types of care that we believe can be delivered via direct care and direct pay. And so according to our analysis, which is, probably even a bit conservative, we think about 60% of the total spend in the US can be converted to a direct care or a direct care / direct pay model, or about $1.8 trillion. So put another way, we think $1.8 trillion of spend in the US can move to this model. And when we do, we believe that there are 30% cost savings to be had by making that shift. We also know, based on survey data from that recent Milliman report, that 86% of the time, DPC doctors are referring patients less often to specialists than their fee-for-service peers. So we already know there's an impact, in the referral patterns from DPC, but we think if those referrals can go to these direct care and direct pay settings, 30% of cost savings could be had. So a really big why there for all of us. And, as we know, we heard from Dr. Kristen Dickerson this morning from Green Imaging. We know this is already happening out there in the marketplace with direct care, direct pay diagnostics. We see Quest even getting in this game with direct-to-consumer labs. And then, of course, Surgery Center of Oklahoma with their case rates for surgery right out there on the website. So we know the market is moving in this direction. We hear it from you. We see it happening in the marketplace. And then interestingly, because not all of this downstream care is being delivered outside of your walls, we see it happening inside DPC where you're expanding your services as well. So we took a look at our data over the last 12 months, and we saw that 16% of the charge volume that goes through Hint are non-membership charges. So that 60% of everything that goes through Hint are related to incidentals, things that you're charging for outside of the membership. So of course the membership stays at the core, but we know other things are happening as well. That represents 604,000 charges billed in the last 12 months across 31,000 distinct items. So, certainly something going on here. So we look at what's happening out there in the market, we look at what's happening inside Hint right now, and we know that now is the time for us to move where you're already moving, to move outside, but outside the membership and outside the DPC. So someone made a great analogy to me this week when we were getting ready for the summit, that what we're really trying to do is pave an unpaved road. So this road, you guys have already built the road. It already exists. You cleared the trees, but it's probably still a bit difficult. There's probably still some paperwork. There's probably still Excel spreadsheets and phone calls. So what we want to do, this is what technology is meant to do. What our product is meant to do is make all of that easier and seamless for you, and have it just happen automatically behind the scenes. So as we seek to pave this unpaved road, this first phase is we want to expand the plan inside the DPC. This is a really important stepping stone for what I'll talk about next, but also something that will help, today. So what you see here is an example of where we're planning on taking the plan. So as you know, any of you who are Hint users, you can create pretty much any kind of membership plan within Hint OS. But what we're going to be adding to that is the ability to specify what's covered under that membership and what isn't, or maybe it's partially covered. Maybe the employer is covering part of it and maybe the employee is covering the rest. Maybe you have different types of plan offerings. Maybe you only have one all-inclusive plan. All of that would be supported under this, but we want to add the ability to structure this a little bit more so that there's less work for you to do in the system as you're billing those 604,000 charges through Hint. So as we do that, you can see an example here of what different plans might look like. So, again, some of you have one all-inclusive plan that completely stays supported. Some of you have multiple plans, and we see you build those out in Hint OS at different price points. So we've got one example here of a basic plan, $50 PMPM, unlimited medical visits, and some low-cost labs, all the way to a more comprehensive visit that might include more services under that PMPM. So giving you that flexibility, making the plan building more robust. And then finally, how that might actually play out on an invoice. You can see here over on the right, we've been able to split those charges to the patient and to the employer. You can clearly see what's been covered, what rule is kind of firing here behind the scenes to designate what goes on the invoice. So this is kind of this phase one. We're actually going to be starting on some of that work in the next few weeks, so very timely, and we're really excited to get started on this path and look forward to working with you and getting your feedback on it, most importantly. And then the phase 2 is moving outside the walls of the DPC. So we know that you are providing a lot of care within your walls, but then you do have to refer the patients outside of your practices. And how can we do that and make it easier, make it more seamless, and have that plan that we were talking about, that more robust plan, follow the patient? So here is one example of what it might look like if we had HintOS built in, say a diagnostic center, which is this, with this example, where we're not talking about active memberships anymore and PMPMs. We're talking more about a direct payment for a service that's been provided, in one of these other settings. So I'm going to walk you through last part of the presentation here, just a couple quick examples of how this might actually play out. So here you've got an example of a basic plan. That basic plan, lower PMPM, x-rays aren't covered. And in this example, the patient calls her DPC doctor. The doctor refers the patient to a diagnostic center for an x-ray. The x-ray is performed, and because that plan information followed the patient to the diagnostic center, the plan rules show that this x-ray isn't necessarily covered by the DPC plan, and the patient's going to pay that full amount at the time of service at the diagnostic center. So we can support that, in the future through HINT, all of that running, the plan attached to the patient, the payment done right at the time of service. All right, the second example would be a more comprehensive plan where x-rays are covered by the DPC plan, but the DPC location doesn't have an x-ray machine. So same use case, the patient calls the doctor refers the patient to the diagnostic center, patient shows up, again, the plan followed the patient there, and the plan rules show that the DPC plan is covering x-rays, and this is a use case I know some of you are already doing. So in this case, the DPC can pay the diagnostic center, again, immediately all through HINT because that plan followed the patient. All right, and this last example, how this might play out for employers, in this case, the employer splitting the cost of the x-ray with the patient, 50%. So same use case, the plan followed the patient again, shows that the patient's responsible for half of the payment. Patient can pay their right at the point of service, and the employer can pay the remaining. So in this way, we're giving access to these direct care, direct pay workflows and arrangements, up to the employer as well. So we know that these things are happening out there in the community that you're building your networks, but we want to make it less cumbersome. We want to make it easier for you and for the patient.
Hey, so Jen, awesome work. And I wouldn't know what I'd do without you, Jen. But just a couple of questions here. So what you're saying is that we're going to build out HintOS for other types of practices other than primary care. Is that kind of what I'm hearing?
Yeah, that's what you heard. That's what you saw. So that would be the plan, that we would be able to build out HintOS, but build it for some different use cases than, the world centered around membership. Still direct care, direct pay. We're not recreating, practice management, but the ability for other types of care settings to leverage direct care and direct pay. And as we do with everything in our product, everything is accessible via API. So if integrating with other systems is the best way to go for those centers and for DPCs, that's something that we would be able to do as well.
Great. So I can see how this will make it easier for the providers involved. But what do you see as the benefits for patients? How does this actually impact the patient, and why does it matter, I guess?
Yeah, great question, because of course, if it doesn't benefit the patient, it's not something that, that we want to do. So I really see the benefits to the patients as twofold. So one, even in this world where DPCs are forming, their own networks in their communities, and we have more and more, downstream providers going direct. I even heard this morning an example of, multiple phone calls that have to happen to make all of this go. So I think, number one, this removes some of that administrative barrier that could get in the way of the patient getting that downstream service that they need. And second, we know cost is such a barrier for patients getting the care they need. If we can enable, DPC to go to a direct provider and let patients get, take more and more advantage of those, of those cash pay rates, we're hoping that we can remove the cost barrier to patients getting the care they need as well. So removing administrative barriers and removing cost barriers.
Great. And Jen, we've just got one more question here. So I know we've got a lot of DPCs out there who are already connected with direct pay specialists and facilities. Will we be able to help any of those that do or don't, or who want more of this to sort of help connect them to these types of specialists? How will that work?
Yeah, absolutely. So, similar to what you described around affiliates, things were already happening in the marketplace. We, built our technology to support it. But since then, we have more clients, more DPCs coming and asking us, hey, can you connect me to another DPC? Do you have anybody in this area? We're going to replicate the same thing as we move downstream. Many of you have met or worked with Beth Holmes, our network development lead. So we just want to extend the ability to connect you to each other, both outside of the product and inside the product, to help you build bigger and stronger ecosystems and really add more color to your diagram there, Zach, and more connections.
Fantastic. Thank you so much, Jen. Always great to hear you presenting, and I'm sure everyone really enjoyed that. So thank you so much. I just wanted to spend a few minutes going over a little bit of a recap of Summit and just kind of showing a few statistics about what we've had over the last few days. But I've got a little bit of data on networking. So during this event, there's been 619 total meetings. There's been 540 speed dates. We've had a lot of feedback that people love the speed dates, so we're happy about that. We've had almost 500 connections been made. So that's when people meet and they actually share information. So that's pretty cool as well. And then there's been about 170 people that have showed up at the expo booths and kind of connected with those booths. So we're some great data. We've got a few rewards here as well. So Brad Ferris, if you're there, you were the most outgoing. So meaning you made the most connection requests. So that's awesome. And then we've got Dr. Diana Gonita is the most popular. So that's the most people that tried to connect with you. So congratulations, you're very popular. And then we've got the third here, Dr. Dave Rogers was the most connected. So this is the most that both connected, basically I think the most connections accepted or something like that. So you've got the highest concentration of activity. So that's kind of what we've got there. We've also had a few other surveys going through throughout the event. So here are some of the results. How many other clinicians do you personally know who would like to switch to practicing in the DPC model? So it's interesting, pretty interesting. It's 1 to 2 seems to, 75% of people had between 1 and 5. So that's good. So great work. We've got DPC practices. How willing would you be to work with health plans representing patients with a per member per month fee payment? I thought this was pretty interesting. Seeing about 50% of people would be somewhat willing or very willing. So that's interesting data for some of the plan sponsors out there. And we've got some work to do to help increase that, or maybe not. Maybe actually staying purely independent, maybe that's good for 50% of people and it can stay that way. So interesting data. Now, for DPCs, do you currently work with TPAs and or benefits advisors? So it looks like about 50% of people are either already doing that or working on it. So interesting. Looks like another question here, TPAs, benefit advisors, and employers. What is the biggest barrier to work with DPCs? So, it seems like the winners here are around the contracting process and locating the DPC practices. So on this point, I encourage you, we've got a number of partners, obviously, that are sort of here. But also, if you're struggling with this, please reach out to our network development lead, Beth Holmes, who works very closely with connecting our DPC networks, our providers to DPC networks, connecting to plan sponsors like some of the ones we mentioned today. And so she's a little bit of a kind of a matchmaker in that respect. So, and then we've got one more question. Do you currently work with employers? About 50% of DPCs currently work with employers, which is pretty phenomenal, I think. So great work, community. And what I'm going to do now is I'm going to go have a quick look and see the results from the surveys we just did. I'm going to read them out real time here. So how do you identify politically? We've got 47% Democrats, 22% Republicans, 22% independents, 4% Libertarian, and 4% Green. Interesting. And that's on an N of about 50 votes or so. Has Hint Summit 2D been worth the cost? 100% yes. Excellent. I'm glad to hear that. There's 44 votes. So that's really good feedback for us. How valuable did you find the session and stage content at Hint Summit 2D? Very valuable, 76%. Somewhat valuable, 24%. And 0% not valuable or not very valuable. Well, that's awesome as well. Thank you for that feedback. This is encouraging us. And then we've got this last question here. How valuable did you find the networking sessions at Hint Summit 2D? Very valuable, 49%. Somewhat valuable, 47%. And then last question, did you enjoy your overall Hint Summit 2D experience? 100% yes. Fantastic. Oh, and then we've got one last question here. This is the edgy one. Who is getting your vote for president? 61% Joe Biden, 22% Donald Trump, 4% third party, and 12% undecided. So with that, I wanted to thank everyone who's been a part of the Hint Summit and the Hint Summit Virtual. It truly is an honor to have you all here. I know it's a lot of time, but thank you so much for being part of this. And we're really excited to see you at the next event. We haven't quite figured out what it's going to be, but rest assured there is going to be something. And thank you. And with it, I'm out. Thanks so much.